Physical activity, such an important issue, and just more and more research in this area that it's critically important for a host of different reasons, particularly for people who have been diagnosed with cancer and are beyond treatment. We're seeing more and more research now that physical activity absolutely reduces risk of recurrence of breast cancer and colon cancer. If there's anything we have that's close to a magic bullet for health, it's physical activity. One of the big challenges people face certainly is stress. And certainly once cancer, once you've gone through treatment, this stress of, am I going to get cancer again? What can I do to reduce my risk of this happening again? Physical activity is one of those things that is always on that list of answers. We know that particular treatments might impact muscle mass. We know that being active and strength training can help with that. We know certain treatments might impact bone health. We know that walking, weight-bearing exercise like walking or strength training can help with that. We know some people might experience balance issues as a result of treatment. And again, that's another thing that physical training can help maintain balance or better balance with people. So for a whole host of reasons related to treatment, physical activity is important. Anybody with cancer should strive to be active for at least 150 minutes a week of moderate activity. And one way to think about moderate activity is walking a mile in 15 minutes. That's moderate. So it's 150 minutes of moderate activity a week, or 75 minutes of more vigorous activity, going out running, that type of thing, or a combination thereof. We're seeing more and more community-based programs with people who've been specially trained, people who understand exercise, who are fitness professionals, who've also been trained to understand that cancer experience and kind of put those two disciplines together. And so, really people can, find local trainers and feel confident that they're getting good guidance, that they're getting guidance that really can help with improving certainly their fitness level, but also takes into account what challenges potentially this person might be experiencing from having undergone cancer treatment, and can really marry those and make good solid recommendations to them. Our recommendation is that survivors be as active as they can, but certainly there are some things to think about. There are some precautions that particular survivors really should be considering. Certainly if somebody has very severe anemia, we might encourage them to hold off being active until that gets corrected. People who have catheters or feeding tubes, certainly going swimming or being around pool or lake water, is not the best thing. A lot of times people going through treatment, their immune function really has had it's negatively impacted from treatment, and they're at more risk for developing different types of infections. And so we might say, this might not be the time to go to your gym at that time. Maybe you can find something to do at home, or just take some walks through your neighborhood. A number of people who have undergone treatment have neuropathy. They, with their extremities, with their hands, with their legs, with their feet, aren't feeling as stable, as they typically do. And so that might be a time, to, instead of, walking or running on a treadmill, if you're doing that, holding on, or even sitting on a stationary bike, so that you're stable and you're not having to worry about that balance and not being able to feel your hands or your feet. So even though there's a number of precautions that we recommend people consider, we still, don't want all of those to completely, stop somebody from doing some type of activity as best they can throughout the day. And we also recognize there are days you're just not going to feel like it. And again, don't beat yourself up on that. But when you're able to, when you feel up to it, grab your family member, grab your neighbor, and even just go on a little walk around the block if you can.